You have to take the patient's name, you record it, the age, the sex. Now in this EKG, because this is electronic and automatic, it will tell you right away the exact heartbeat, which is 72. Now you also take note of the height of the patient, the weight, the blood pressure, and the medicines that the patient is taking. Now some electronic EKG are interpreted by computerized way, but it is still best that the doctor who understands how to read an EKG reviews that computerized reading. In this case, we don't have the computerized reading, so we look at all the leads. No, apparently, the heart rate is normal. It says here 72. If you really check it, the heart rate is really within 70 to 75. Now, you also take note of the rhythm. The rate is 72. The rhythm, apparently in this EKG, the rhythm is sinus. It starts with the sinus node and it is regular or normal rhythm. It's not, there's no arrhythmia, there's no irregular rhythm. And I don't see any signs of ischemia. There are no signs of ischemia. In other words, the patient does not have a poor supply to the heart muscle. The blood is flowing freely enough. Although there is a tendency that because maybe the hypertension is uncontrolled, no, there is a tendency that the heart is starting to enlarge. Not really, it's not really enlarged by ECG, but apparently towards that direction. No? There's a tendency for it to enlarge if you cannot control the blood pressure, the left side especially of the heart, the left ventricle. That's why it is best to control the blood pressure within the normal range to avoid left ventricular enlargement. Okay, so apparently this EKG tracing is almost within normal, no? Within normal range. There is no complication yet to the heart, but there is a tendency. If you cannot control the blood pressure, if you leave that blood pressure stay on the abnormal side, meaning to say it will continue to be on the hypertensive side, in a few years she will develop left ventricular enlargement. Okay, so to continue with the treatment for this case of a hypertensive patient, ma'am, no, apparently your EKG is within normal. I did not find any problem so far. The rate is normal, the rhythm is normal. There are no signs of ischemia or heart enlargement. But then we have to, as I've said, we have to prevent the complications of hypertension, which is heart enlargement and ischemia, or heart failure in the long run. Now, how do you do that? Of course, as I've said, you have to maintain medicine for now. I will, as part of the Trust of the Beautiful Heart Foundation, especially for patients who cannot afford to buy this expensive medicine, I will be giving you free medicine for the next 2 weeks. Okay? So, one medicine that you need is your nifedipine. Okay, we have nifedipine here. So for your blood pressure, since your diastolic is high, it was recorded as the systolic is normal, but your diastolic is 100 plus, right? 113, I think. Yeah. So you have to control that. So I'm giving you now nifedipine, which is a calcium channel blocker, one of the good antihypertensive medication. The equivalent of this is Calciblock. Now, the generic name is nifedipine. This is an extended release or once a day dosaging. This is 30 milligrams. So it will sustain you. Instead of 10 milligrams 3 times a day, you just take 1. Now, you observe,